Hi, I'm Dr. Brian Koffman, a retired family doctor and a CLL patient myself, and co-founder, executive vice president, and chief medical officer of the CLL Society. And I'm bringing to you important papers that have been published in peer-reviewed journals or presented at major hematological meetings. And the one I'm about to present to you is one that I'm really proud of, because the CLL Society and the patients that are part of our community were a major part of this paper. I title the paper, Stopping BTKIs If No CLL Progression Boosts Quality of Life. And what's the bottom line? CLL patients who receive BTKIs, Bruton tyrosine kinase inhibitors, and stop therapy for non-CLL progression reasons. In other words, they stopped it not because the drug wasn't working anymore, but for other reasons. Those patients reported an improved quality of life and prolonged time off of treatment. This supports the value of doing prospective studies on time-limited BTKIs treatment for chronic lymphocytic leukemia, or CLL. Who performed the study and where was it published? Dr. Deborah Stevens of the University of North Carolina led a distinguished group of researchers that included yours truly and Liza Avruch of the CLL Society in publishing Feasibility of Bruton Tyrosine Kinase Inhibitors, Discontinuation in Chronic Lymphocytic Leukemia, the Patient Perspective. This was published in Clinical Lymphoma, Myeloma, and Leukemia on May 16th of 2025. Let's go into the background here a little bit. BTKIs, Bruton tyrosine kinase inhibitors, ibrutinib, acalabrutinib, zanubrutinib, and most recently pirtobrutinib therapies have revolutionized care in CLL. But patients often stop treatment due to reasons other than the fact that the drug has stopped working and the CLL progresses. The most common reason is intolerance to the side effects of the medication. And in other chronic leukemias, chronic myelogenous leukemia, or CML for short, the standard for many, many years was continuous therapy as long as the medication, which was a different kind of which is a different type of kinase inhibitor, was working, until it was proven that these medications could be safely stopped in most patients. Similar studies have not yet been done in CLL, and it is not known what happens to patients who discontinue BTKIs for reasons other than disease progression. What was the method we used for this study? Between March and May of 2024, CLL Society promoted a survey on its website through social media channels to patients who self-reported stopping their BTKIs for reasons other than CLL progression. And what are the results? Well, I'm happy to say just in those few months, a total of 220 surveys were started, but for various reasons, only 170 patients' data was usable and included in the analysis. Of the included patients, 57% received their BTK as their frontline therapy. The first BTK was most commonly ibrutinib, 79%, with a distant second to acalabrutinib at 17% and zanubrutinib at only 4%. BTKIs were discontinued in less than 6 months, 6 to 12 months, 1 to 2 years, and 2 to 4 years, and greater than 4 years in respectively 19, 18, 21, 28, and 14% of the patients. The most common reason for discontinuing BTKIs was toxicity, 62%. That the CLL was in remission, 14%, and personal choice in 8%. What were those toxicities, the common adverse events that led to BTKi discontinuations? Atrial fibrillation, which is a potentially dangerous irregular heartbeat, happened to 1 in 5. arthralgias or joint pains in 17%, and bleeding and bruising in 11%. Of those who discontinued BTKIs due to adverse events, 2 out of 3 reported that it resolved quickly in less than a month. Almost another quarter of patients reported that the adverse events at least partially resolved after discontinuation. When asked about their perception about stopping the BTKIs, the majority of patients were relieved to be free of the side effects of the medication. That was 45%. Another 11% said that they were able to focus less on their CLL, and 7% would no longer have to pay for their medicines. They listed that. However, it's important to remember that 29% experienced anxiety over their discontinuation. A statistically significant increase in perceived quality of life was observed from prior versus post-BTK discontinuation. In other words, patients' quality of life improved after stopping the treatment. 45%, or 76 of the 170 patients, reported no disease progression. The majority were more than a year out from stopping, with 32% 1 to 2 years out and 27% more than 2 years out. In the patients who did experience CLL progression by either noting increased white blood cell counts or enlarging lymph nodes, that was 80 patients, 46% said that these events did not happen for more than a year after the BTK discontinuation. For those who were on a BTK inhibitor for more than 2 years or more before discontinuation, they had more time without CLL relapse. And while a new CLL treatment was started in the first 6 months after stopping the BTKI, in 36% of patients, a full half of all those that did not need to start a new treatment for 1 year or longer. A full half of all patients did not need to start a new treatment for 1 year or longer. So what does this mean, and what can we conclude from this? Despite the fact that the data is all coming from patients volunteering to complete an online survey promoted by the CLL Society, this study does suggest the feasibility for many patients of stopping their BTK for reasons other than progression, especially for those who've been on the medications for 2 years or longer. The majority should see an improved quality of life, enjoy a long time off medication before they need treatment again. It also demonstrates the feasibility of the CLL Society community, both the staff and the team at the CLL Society, but most importantly, the patients and caregivers working together to produce peer-reviewed, clinically relevant research that gets published in major medical journals. And we are very grateful for all those who participated in the survey. We hope that this kind of research will lead to larger prospective studies looking at the possibility of limited duration BTK inhibitor therapy. On the website, we link you to the full publication, Feasibility of Bruton Tyrosine Kinase Inhibitor Discontinuation in Chronic Lymphocytic Leukemia, the Patient's Perspective. Thanks for listening.